Tonight at 9 on WTTW. Programming on WTTW is made possible in part by viewers like you and by the following.
This is our great-grandfather who had a dream in 1945 to open a family business in his name. This is our grandfather who expanded on that dream, bringing custom furniture to Chicago. This is our father and his brothers who grew that dream into the 10 showrooms here today. This is us, 4 sisters who want to make the generations before us proud while making Chicago homes beautiful. Since 1945, this is Smith.
WTTW programming originates from the Renee Crown Public Media Center.
Mrs. Brown, you've got a lovely daughter. In the name of love.
See the girl with the diamond ring. She knows how to shake that thing.
Saturday at 7 on WTTW.
Hi, Chicago. I'm Destiny, and you're watching WTTW.
This evening's presentation of Chicago Tonight is made possible in part by a grant from the William F. O'Connor Foundation in memory of Billy O'Connor.
Good evening and welcome to Chicago Tonight. I'm Paris Schutz. Brandis Friedman is on assignment. On the show tonight,
I have the qualifications, experience, relationships, and vision to lead this party into the future.
Congresswoman Robin Kelly on replacing Mike Madigan as head of the state Democratic Party and threats against the U.S. Capitol.
We're usually never informed of anything.
Trash talk, residents of West Chicago square off over a potential waste facility. The city is the latest stop for our In Your Neighborhood series.
This country will have enough vaccine supply, I'll say it again, for every adult in America by the end of May.
And vaccines could soon be available for all, but will everybody get their shot? But first, some of today's top stories. Appointments for vaccinations at the United Center opened up today. City officials say nearly 30,000 of the 110,000 available appointments have already been filled as of late this afternoon. This comes after the website and phone line went down early this morning because of a rush of demand. Both were back up and running after about a half an hour. Vaccinations for any Illinois resident over 65 will start on next Wednesday, and we'll have much more on how medical professionals are trying to erase the stigma of vaccination, especially in communities of color, in just a few minutes. And public health officials report more than 1,700 new cases of COVID-19 in Illinois and 42 additional deaths. That makes for a statewide total of nearly 1.2 million cases and 20,668 deaths. The preliminary 7-day test positivity rate right now is 2.9%. The Southside neighborhood of Chatham gets a big boost today. Discover Financial Services is planning a customer care center at an abandoned Target store on 86th and Cottage Grove. Mayor Lori Lightfoot and other city officials were on hand at the announcement today. They say the endeavor will lead to 1,000 full-time jobs for local residents with hourly wages of $17 and higher.
And as I said, I know that you could have made this investment anywhere in the world that you wanted, and any other community would have been grateful. But you have chosen to build your stake here in Chicago, in Chatham, and set an example of what real civic leadership looks like.
For the first time in more than 20 years, the Democratic Party of Illinois has a new leader. In a nail-biting election Wednesday, Congresswoman Robin Kelly narrowly beat out Chicago Alderman Michelle Harris to become the first black woman to lead the party statewide. Kelly replaces former Illinois House Speaker Michael Madigan, who resigned as party chair last month. This as Congress debates the latest COVID stimulus package and the U.S. Capitol is on lockdown after renewed threats of right-wing violence. And joining us to talk about all of that is Congresswoman Robin Kelly. Congresswoman Kelly, welcome back. Congratulations on your win. Before we get to state politics.
Thank you so much. Thanks for having me.
You're very welcome. The U.S. Capitol, as we mentioned, is on lockdown today because of more potential terrorist threats. So what's the latest you're hearing about the situation?
I really haven't heard that much. You know, we were supposed to get out today, but we ended everything yesterday, the votes that we had planned on, so that people could either leave last night or, like myself, I left at 6:30 this morning, so it's been a long day.
All right, moving to the state, you were just elected to head the Democratic Party of Illinois. Briefly tell viewers what that job is.
Well, there's 36 of us. Each congressional district has 2 people representing it, 1 man and 1 woman. And actually, we're there's committee men on every level, and we're the committee people for the state. So, we work to keep the state, of course, for us, blue, to get more voters, to educate voters, to work on ground organizing or grassroots organizing, and then we have the responsibility to assign who will be delegates at conventions, like presidential conventions.
And you're replacing, obviously, House Speaker Mike Madigan. You've promised to bring greater transparency. What are some specific ways you will lead this party differently than Madigan did?
Well, a couple of things. Just some things are very simple. We will meet more. We will get to know each other more than we had the opportunity to before. I plan on creating committees, like program committee, recruiting committees, financial committee, just different things like that to help us reach back into our own communities. I want to do something where I'm uplifting the local organizations, the local county chairs. Hopefully, I would love to have like grants so they can do some of the programs that they can do. We're looking at redoing the bylaws. We're looking at doing extra efforts towards some groups for recruitment, like the Latinx community and the rural communities and areas that people deem red.
And, at that election yesterday, it was very tense. As we mentioned, some Democrats raised concerns that federal law would prohibit you from raising money in state and local races because you're a federal politician. Let's hear what former Illinois Senate President John Cullerton said about that.
One of the biggest things the state chairman does is raise money, whether we like it or not. That's one of the things we have to do. So to be a chairman and not be able to raise money is really a limitation.
Do you agree with that? Will you be limited in your ability to raise money?
I will be limited in my ability to raise some of the state money, but I can raise the federal money. And as I shared last night, last Congress, I raised $3 million in federal money that I helped with, electing more women, and then I raised my own money, and then I had to pay dues. So I might be limited in some ways. We'll set up guardrails, but it's not an obstacle to me being the state party chair. Plus, we said we didn't want to continue being a one-man or one-woman show, and that everybody will get involved.
So other folks will probably have to get involved in those fundraising efforts. Also, Governor Pritzker made no bones about the fact that he had supported Alderwoman Michelle Harris for this position. Pritzker, as you know, not only the highest office in the state held by a Democrat, but the main funder of the party at this point. Will you two have trouble getting on the same page?
No, I don't even think that at all. I mean, we want him to be reelected, so I'm going to do my part to make sure that that happens. I mean, he had his person that he wanted, which is fine. That's the Democratic way. But the race is over, and now we pull together.
I want to move back to Congress for a second here. The $1.9 trillion COVID stimulus bill. In moving through the Senate right now, do you anticipate that will pass the Senate and then complete this reconciliation process once and for all?
I do believe it will pass the Senate. at least my Democratic colleagues know, people are hurting. There are things that are going to expire. People need the money. Small businesses need help. People need their vaccine doses, and schools need to reopen. So I'm confident that the bill will pass.
And also this week, the House passed a sweeping voting rights bill. Now, this comes as several states like Georgia and Arizona have passed legislation or moved legislation to restrict voting. What does the federal bill do?
Well, it does a few things. If you're speaking of H.R. 1, is that the one?
Yes.
Yeah.
I'm not 100% sure on the title of it, but the Voting Rights Act.
Yeah, I believe you're talking about H.R. 1. It does a few things. It takes the dark money out of politics. As you said, it deals with voting rights and not allowing the votes to be suppressed, looking at like ID and different things like that. And now my mind is skipping on the other thing that I was getting ready to say about it. But there's H.R. 1, and then there's a companion bill, H.R. 4, which we're calling the John Lewis Voting Rights Act. But it's all to prevent states from putting in, you know, all of their rules and measures to keep people from voting. And since November 4th or November 5th, so many states have tried to, like, a lot of states have put in a lot of measures to restrict people. So this wards off that.
All right, getting back to politics, Congresswoman, one of the functions coming up pretty soon is redrawing the state's legislative maps. A lot of observers say it should not be in the hands of politicians. How do you plan to approach redistricting?
That was the other thing that the bill dealt with. I'm glad about having independent people draw the maps. You know, I agree with that. My only issue is my Democratic colleagues that come from like Alabama and Mississippi, where they're the only Democrat in the state, and they worry about, in this instance, who's picking the independent people, and they feel like in their states, the independent people will be Republican. So they're really, really concerned about that. I voted for the bill because also I feel like jamming like even African Americans, jamming a bunch of African Americans in one district. I'm not for that either.
So there's
many of my CBC members.
I'm sorry, Congresswoman. We're out of time, but you know, a lot of issues to iron out there. No, all right. Thank you to Representative Ron Kelly. Thank you so much for joining us.
Thank you.
And up next, the latest stop for our In Your Neighborhood series. In DuPage County, the COVID case rate among Latino residents is more than 2 times higher than for non-Latinos. Certain pockets of DuPage County have been hit harder by the pandemic than others. Near the top of that list is West Chicago, a community where half the residents are Latino. Amanda Vinicky is there now for this week's edition of Chicago Tonight in Your Neighborhood. Amanda.
Paris, I'm hoping that you can see it just over my shoulder. What's now West Chicago was once Turner Junction, a town established where early railroad routes converged. Mayor Ruben Panetta says back then, livestock was raised here, then transported via rail to Chicago's old stockyards.
It's one of the largest natural prairies in the state of Illinois and one of the largest prairies in the country. So it has a lot of native plants from Illinois, and it's just beautiful. So it went from a stockyard to one of the most glorious and beautiful prairies that you can imagine.
That's transformed, but trains do still run through town to this day, hoping that we're going to skip any freight ones during this segment, though. Normally in July, the city celebrates that with its annual Railroad Days. Instead, just days ago, West Chicago canceled that festival. Also, the Spring's Blooming Fest, both because of COVID. Now, speaking of Blooming Fest, West Chicago has an active, you could say, blooming garden club, and the community is also part of an effort to save pollinators. As for one of the big pollinators, butterfly monarchs, well, there's a special connection.
A lot of our population here is from Michoacan, and that's where the butterfly migrates to every year.
Now, as for COVID, West Chicago, as you said, was hit hard with nearly 4,000 cases in the main zip code here. The mayor says it wasn't until recently that the positivity rate dropped below 10%, but he is working to turn that around. Just yesterday, West Chicago hosted a mass vaccination clinic, and some 2,000 residents got their first shots. Local Senator Karina Villa says the reason for that high caseload of COVID here is because residents are the workforce for many local manufacturers and warehouse facilities.
Many of the employees of those manufacturing companies come right here from town. It is something that we are very proud of, to contribute to our economy in that way. But as you know, some of these factories were bad actors. They did not take care of their employees.
She did not call out any specific bad actors. So not saying these are them, but some of the big businesses that have been around West Chicago for a long time. You know, those Flavor Ice popsicles? They are from West Chicago's GelCert. Also, Ball Horticultural Company ships seeds around the world from here in West Chicago. The mayor says after local governments got together with an incentive package, a tech park is now bursting. Lakeshore Recycling Systems already has a facility here in the industrial part of the city, but there is talk of an expansion. That LRS plans to build a waste transfer station. The company is keeping quiet, saying only, "We have nothing to discuss at this time regarding our West Chicago facility, as we have not yet filed an application and have not made a decision whether or not to do so." But a well-organized group of opponents are already fighting it, among them longtime resident and realtor, concerned that it will decrease property values and scare off would-be home buyers.
People who wants to move in, they usually check everything, you know, the schools, what else is in West Chicago, and looking at a second transfer station, garbage transfer station, then definitely will make an impact, negative impact for people who wants to move in West Chicago.
Eduardo Lopez says he's worried about the odor. There is another waste transfer station already in West Chicago that is Groot, and Lopez says that it smells.
Y lo que no estoy de acuerdo, ¿por qué vamos a agarrar basura o lo de otro pueblo?
Lopez asks why LRS isn't looking at places, communities like Oak Brook and Glen Ellen, but he has an answer to his own question. He says those communities wouldn't allow it, and he suspects that it is because of West Chicago's large Latino population that they're focusing here. But Senator Villa says she's done extensive research. She says that the LRS facility would be state-of-the-art, meant to keep out those smells, and she says it would bring solid, good-paying jobs.
The thing that's really important is that people should know it's a transfer station. The garbage that comes in is going to be sifted through. There's going to be whatever is recyclable will be sent to be recycled, and the other materials will immediately be put into containers and shipped out.
Villa is full of pride for the town in which she was born and raised, and when she goes to Springfield next week, she plans to advance legislation impacting those hit hardest by COVID, including a worker rights bill. Meanwhile, the mayor's next mission is to revitalize downtown, hype it up so that people can hang out here and then take the train into Chicago. Also, he wants to focus on the next generation. West Chicago is home to an early childhood center that serves families within 100% of the federal poverty line.
Our mission is to really prevent the achievement gap that exists between different socioeconomic classes. So we serve the most under-resourced children and families because we believe that all children deserve quality access in the first 5 years of life.
Educare takes a comprehensive approach, so that includes family engagement, even working with parents to do things like resume building. Also, it is a dual language school, and that means that 2 out of 3 teachers in every classroom, well, they are bilingual. With that, Paris, back to you.
All right, Amanda, thank you so much. And coming up, overcoming vaccine hesitancy. But first, we take a look at the weather. Earlier this week, President Joe Biden announced the U.S. would be getting enough coronavirus vaccine by the end of May to vaccinate all adult Americans. But anti-vaccination conspiracy theories continue to spread on social media, and there are still many people who remain distrustful of vaccines in general. Others, of course, are keen to get the vaccine as soon as possible. Here's what Rose Guevara of Little Village told us last week.
I feel, and my kids are school teachers and they've been vaccinated also. So now we could just get together, I think. Still wear our mask and our distances, but still finally get to hug everyone.
And joining us now to talk about the issue of vaccine hesitancy are Dr. June McCoy, a geriatrician and cancer specialist at Northwestern University's Feinberg School of Medicine, and Dr. Marina Del Rios, an emergency room physician at UI Health, who was the first person in Chicago to receive a coronavirus vaccine when the city's vaccine rollout began. Welcome both of you to Chicago tonight. Dr. Del Rios, you heard the happy camper there from Little Village upon getting vaccinated. What is the overall sentiment you're hearing in the Hispanic Latino community? More like her or more hesitancy?
No, I'm actually seeing, at the beginning there was a little bit more hesitancy, but I think as there's been more reports of people getting vaccinated, people are excited and are lining up and waiting however long they have to get their vaccine.
And Dr. McCoy, as a geriatrician, what are you hearing from older adults that you treat?
Older adults are excited about the vaccine. I think they're accounting for maybe the most cases of people getting the vaccine in the African American community. Very excited and willing to wait overnight in long lines to get the vaccine.
And Dr. McCoy, can you just tell us how the pandemic in general has affected older adults, not just physical health, but mental health, since many live in isolation, they might be widowed? Explain that.
The pandemic has been devastating for older adults. Many of them, as you said before, are isolated. They cannot have that contact with their family members. They're missing their grandchildren. They're missing their friends. And what we have seen is a worsening of people's memories and cognition because of this. We've seen some people not really eating as much, so we're seeing some depression arising because of the pandemic. It has been hard on the older population.
A lot of related health issues for the older population. Dr. Del Rios, when we spoke last, you said there was some hesitancy even among your colleagues in the medical profession. Has that also gone away a little bit?
Oh, that's changed significantly. There's still a couple of stragglers. That happens with the flu vaccine every year too, but for the most part, almost everyone by now either has made an appointment or has already gotten their shot, and that just brings me so much joy.
So it seems to be catching on among all demographics. Dr. McCoy, we know about hesitancy in the African American community just because of past history of unethical research. Have some of those concerns been assuaged with this vaccine?
I wouldn't say they have been assuaged, and actually I wouldn't say that that's the primary reason why African Americans are hesitant about taking the vaccine. I really think it goes to a distrust of institutions, of the government, and a distrust that's built up over the last few decades where African Americans are wondering, why are you suddenly interested in us when we've not had good access to care? When people are not coming to our communities to help us to provide for ourselves. So I think it goes to this distrust that has built up over the last few decades and not really, for instance, Tuskegee being the major issue at all.
And as a result, there have been heavy outreach efforts to work on that distrust, including by the Vice President of the United States, Kamala Harris, who called into WBEZ yesterday.
I think that the access issue is increasingly becoming the issue, or more of the issue than hesitancy, because in my travels, mostly virtually these days, but in my travels, folks are saying, I want the vaccine, how do I get it? And yes, there is some hesitancy, but we also want to make sure that there's not an accessibility issue.
So the Vice President, Dr. Del Rios, says it's more about access than hesitancy. You see the United Center site accepting reservations now. Have some of those access issues been solved?
No, and if anything, I worry that this mass vaccination site is going to undo the little bit of progress that we had accomplished with the Protect Chicago Plus program. I mean, the ZocDoc website is incredibly difficult to navigate, particularly for people that may not be tech savvy. or may have visual acuity deficits, as is the case with a lot of our elderly folks. The language barrier issue is a problem. And I personally think that we need to really invest in our community clinics rather than these mass vaccination sites are all glitz and glamour. They're not going to fix the disparities.
What about that, Dr. McCoy? I mean, the city officials have touted increasing equity numbers, whereas several weeks ago it was majority white folks getting the vaccination. They say communities of color have improved their numbers. Have you seen that?
I haven't really seen that, and I have to agree with Dr. Del Rios. I believe that a trusted messenger in a community, in small clinics, will do a lot more for getting more African Americans opting for the vaccine. When I am doing something for myself or want to fix something in my home, I don't look in the yellow pages. I call someone I trust and I ask them about it. I think the trusted messenger, that so-called super diffuser, will be the one to educate and help our communities to move forward.
So it seems consensus here to take it back to a community level to really improve those numbers. Dr. Del Rios, we mentioned at the top there's also a lot of conspiracy theories. They get spread on social media. Do you hear some of these conspiracy theory worries from patients?
Oh, sure. I hear some of them, but that's not really the main issue that's keeping people from getting vaccinated. To echo what Dr. McCoy just mentioned, it's really about access. The conspiracy theories, they happen with even your regular vaccines, right? How many parents are opting to not vaccinate their children because they're afraid about them getting autism, even though there's plenty of data that has shown that that's not the case. But, you know, most people want to get the vaccine. Right now, we just have to get the vaccine to where they live, congregate, and work.
Dr. McCoy, what about concerns, especially among older Americans, that there could be health effects from taking the vaccine? How do you assuage those concerns?
Do you know what makes me so heartened is that the older adults are not really that much concerned about getting the vaccine. They actually want it. So for them, it's going to be more an access issue, making sure that we get the vaccine to them. We're not seeing a major concern at all. I don't hear them saying they're going to become Frankensteinian. I hear younger people saying that, but not the elderly at all.
And so what do you want to tell city leaders about improving those equity rates, since you're saying that they really need to trust the folks that are disseminating this information?
I would tell this city, continue to give the vaccine, try to get to herd immunity on a community level, and use trusted people, trusted messengers. If you give enough of the vaccine, eventually my neighbor will get it, and my neighbor will say to me, see, I'm okay, and I will be open to getting that vaccine, of course, if there's access.
All right,
So
I'm sorry.
Invest in the community.
All right, we'll have to leave it there. Our thanks to Dr. June McCoy and Dr. Marina Del Rios. Thank you so much.
My pleasure.
Thank you for having us.
And that is our show for this Thursday night, abbreviated to bring you special pledge programming. And please join us tomorrow night at 7 for the Week in Review. Now, for all of us here at Chicago Tonight, I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and we'll see you tomorrow.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is proud of its partners named Illinois